Hi, I'm Dr. Renee Kunkel, physical therapist.
And hi, I'm Dr. Bianca Madrigal, physical therapist at Balance Physical Therapy. And in today's segment, Everybody Poops, we're gonna go over different things to do while you're on the toilet. So if you find yourself having a really hard time being able to evacuate while you're on the toilet, there's a few different things that you can try in order for you to have a little bit of an easier time. So mechanically speaking, the way that your pelvis sits on the toilet is a little bit elevated. The way that we're supposed to be while we're on the toilet is a little lower, more of a squat position, so that the rectum is not getting choked up by your puborectalis while you're on the toilet. So your puborectalis wraps around the rectum and pulls it shut when you're in an upright position like this. But when you squat and your pelvis tucks under you, that muscle releases a little bit and you're actually able to evacuate a lot easier. So how do we do that on the toilet? Most toilets are going to be pretty high like this. So a few different options that you can use is a nice little step stool where you can bring your feet up high and you've got a little bit more of that posterior tilt going. So if you have that pelvis right next to you, it's tucked right under you and you have a nice straight shot for the toilet. Another thing, if you don't have a step stool, don't worry about it. You can always use anything you have around the house. So this is a nice box of gloves. Use that. The point is to have a comfortable position once you're in that flexed position. And the reason for this is if you're not able to relax your entire body while you're on the toilet, your pelvic floor isn't going to relax either. So you want to be able to actually sit on the toilet and be comfortable in that tucked position. A few other people can sometimes change the position of their pelvis by doing, a little pelvic floor dance, either being tilted forward or off to the side. That can also help increase that angle so that you can have an easier time evacuating. Another couple of things that you can do to help make the flow a little bit easier is definitely drinking quite a bit of water throughout the day. Common knowledge is to drink about half your body weight in ounces, and that can be very daunting at first. So start with small little steps, even just adding 1 glass of water a day. Anything else to add as far as things to do on the toilet for us to be able to relax that pelvic floor and evacuate easier?
No, the only thing I was going to add is Bianca alluded to the stool. That's why squatty potties are such a hit, is they're bringing that pelvis tucked under and increasing your hip flexion, which is going to relax that puborectalis muscle. So that U-shaped muscle, it's going to let it open, allowing things to come out easier.
And key is being able to be relaxed on the toilet. So if with that squatty potty, your knees are much higher than what you would comfortably have in a seated position, then that's gonna be a little bit too high for you. So you can always grab an old textbook from your library and see if that works out for you and start stacking them and see what height is gonna be best for you.
And if you have any more questions, come see us at Balance Physical Therapy.